Okay, so first of all, can you introduce yourself for the audience?
Yeah, absolutely. My name's Azita Nejaddehghan. I'm a physical therapist and a strength coach, currently assistant of player rehab for the XFL and assistant player performance coach as well.
So how exactly did a physical therapist and the strength coach combine together help you like build your program or like understand the movement or understand the game demand more?
Yeah, I'll start with the beginning part of that question. As far as movement and building out a program, I think it creates a really holistic approach. So, I think it's easy to be holistic, whether you're a strength coach or a physical therapist. Look at the athlete not just as an injury, but as an entire system that includes all biopsychosocial considerations. But when I say holistic in the sense of your question, it's more so that I have both the medical and the performance lens when looking at that system or that athlete. So I think it helps me have a consideration of both sides of the spectrum and then being able to just sort of bridge that gap a little more naturally between the two realms as well.
Cool. So, um, do you personally use some like systematic like assessment movement assessment like SFMA that kind of stuff?
I've used it in the past and I still, no matter where I am, it depends on the organization I'm with and what sort of movement screens or subjective assessments that they implement. So I have been exposed to that a lot before, but even nowadays, no matter where I am, I always include some portion of the SFMA in the beginning portion of my exam. Yeah.
Cool. So I know you work with baseball before, and now
Hmm.
you're working with football. So how
Yeah.
exactly uh is like I know the game is a lot different. So can you explain as a performance staff or as a physical therapist, how did you guys operate differently?
Yeah, I think that's a great question. I think both athletes in baseball and football require a little maintenance, but the way the maintenance is delivered, or even asked about is completely different. So with baseball players, they tend to be a little more self-aware, in tune, and on top of their own maintenance in the sense that they will ask for what they need, whether it's soft tissue treatment, specific exercise, some to specific to something going on with them, or just in general, they want to stay on top of things throughout the season. But whereas football, just because of the psyche, it tends to be a little different. And with those players, you don't get as much forthcoming with, hey, I think I need this. I think I need this. Football players tend to try to work through things on their own and essentially toughen things out. So with them, it's a little different in terms of just staying on top of little small nuances that even aren't keeping them out of game, but just wanting to fine tune throughout the season. So that would be definitely one big consideration and difference between the two.
So in football, there's like a lot of acceleration, deceleration, change of
Mm-hmm.
direction. And in baseball, there's a lot of rotation.
Yeah.
Does your baseball experience kind of help you or it's kind of separated?
No, that's a great question. I think what I took away from baseball was exactly that, a lot more comfort in progressing, regressing, loading, all rotational movements, whether it be in the weight room or out on the field. That's definitely something I took to football with me. And then one other thing besides rotation that I would mention is unilateral work. I think baseball does a great job at loading unilateral work and loading it heavy. And that's another thing that I think sometimes football is dominated by heavy sagittal plane bilateral work. And so from baseball, I think I took away those two big things as far as just strictly weight room stuff is rotational work and that heavy unilateral work as well.
So would you can you kind of explain a little after the baseball experience, how would you
Mm-hmm.
program their strength training program
For baseball or for football?
for football, sorry.
Yeah, for football. I mean, I think the football work is pretty typical in terms of just how I changed it. I think I added a little bit more rotational work, like I mentioned, and then always making sure that we had some sort of heavy unilateral loading exercise, and also understanding how to start that in the off season, make sure we get that quality of movement and progress it to the point where we could load it heavy, because that's not necessarily the starting point. You're not going to be in a heavy skater squat from day one. There's a regression to that and a progression to that. So starting from there, but in general, when it comes to football, I mean, you're getting from the off season to in season, you're big on speed work, so always getting speed work in. Big on plyometrics and developing power, rate of force development, and then getting in that agility, change of direction. So kind of starting from the deceleration side of things in a controlled manner, progressing through change of direction, eventually getting to the point where it's agility with a true cognitive perceptual demand on it, reactivity involved, and then your strength work as well, starting in the off season with a typical kind of periodization scheme into the in season. But I would say in season, a big philosophy of mine is still filling those buckets and filling the buckets that aren't filled by the game. So you mentioned, for example, there is a high amount of decelerations in the game of football. So in season, necessarily, that might not be what we're training when we get them on the field as strength coaches or performance coaches. It might so more be just filling that max velocity bucket with a minimum effective dose in season.
Nice, like it. So, uh, as a performance coach, and also like a physical therapist,
Mm-hmm.
how would like football is like brutal. There's
Yeah,
there's crazy speed, crazy acceleration, and like really good like change of direction and like deceleration, but at the same
yeah,
time, like people are gonna hit you at full speed.
yeah.
So like there's gonna be tons of like injury, like
Mm-hmm.
yeah, maybe there's ACL, maybe there's hamstring, maybe there's like concussion. So
Yeah.
as for your experience, like what type of injury you work on the most?
Yeah, I would say specific to my setting where I was in this past year, some of the things we saw the most was exactly what you said, those knee injuries, and I'll just bucket all kind of ligaments in there together. So your ACLs, your MCLs, occasional LCL, PCL. But like you said, knee injuries kind of first usually. Did see a lot of hamstring strains, which are common in football, and then especially those high speed positions, your skill players. And then so a lot of ankle sprains, that's probably common across all football leagues as well, not necessarily just ours. Hip, groin, kind of I'll throw together as well, and then occasional shoulders injuries as well. But those top three kind of being the knee, hamstring, ankle.
Cool. So because I work with like track and field, so I know like
Mm-hmm.
groin injury, groin pain, or like hamstring, they're kind of like, or even ACL, they all kind of like correlate with a hip or pelvis.
Yeah.
So is that a thing like you work on a lot?
Yeah, that's a great question. I'll get a little more specific on this one and zoom in. Real quick, I will say yes, with knee, hamstring, ankle, or really any injury or kind of dysfunction going on, I'm always checking the joint above and below, assessing the entire kinetic chain. So certainly the pelvis is always something to consider. Just based off of my experience, I think it's been the most relevant in some of my hamstring cases. So something that, again, a kind of specific example I'll give is my with the hamstring players, a lot of times before you're ready to get in back into sprinting. Sometimes somebody's ready day one, depending on the severity injury. Sometimes you're waiting a couple weeks, but I'm doing things in the clinic or pre-field activity to kind of mimic the positions of sprinting and see how they do with that. So that can be some of your isometric push exercises, or also something as simple as wall drills. Because a lot of times I would get guys into that position on the wall drill, tell them to find their most comfortable position kind of in the acceleration posture. And then you would see that sort of massive anterior pelvic tilt. So, how much of that is significant in eyeball? Who knows? But I do believe there's a strong correlation there, just practically speaking, from seeing that, significant anterior pelvic tilt and how that carries over onto the field and that positioning, and it only tends to get a little worse when they're in a high speed movement as well. So that's something that I would see in the clinic in that position or posture, and then try to address it and get them to be able to get into the correct positions or patterns or postures statically and then slowly we would carry that into more dynamic movement. So another great practical way to see that is with overhead A series. So just having a PVC pipe or arms overhead. So one, you might see that they just can't maintain their arms there, or two, if they do, that they kind of lose that pelvic positioning or ability to stay stacked in that vertical position.
Nice. So it's interesting. I kind of like work on like posterior pelvic tilt the last few days with the track kids. So and some of them like have like back pain, some of them like
Mm-hmm.
just strain their hamstring a lot. And I kind of like help them like do some corrector exercise with it. They kind
Mm-hmm.
of feel better. So what would you do for like when they have posterior pelvic tilt?
Honestly, you're saying they have an excessive amount of posterior pelvic tilt, or you're trying to train that in them?
I try to train that.
Okay, honestly, exactly what I just said. I like starting in the static wall drills. So I'll start with literally just a double leg hold at the wall and just see if they're able to maintain that. And I always say it shouldn't feel like a lazy, easy thing to do. It's the same thing as being able to hold a plank, right? If you do a plank with kind of more of a passive effort than an active effort, you could probably hold that for a minute. But if you're actively pulling your elbows down and your toes up towards each other, then it becomes a little harder and you feel one, that posterior pelvic tilt, but two, more of an active effort to maintain that trunk posture. So that's exactly what I train in the double leg wall drill as well. So I'm training those angles that we're looking for, and then also training that pelvic positioning. And then the progression for me is just a single leg isometric hold, and then from there going into a load and lift, and then we would go into a load lift and switch. And I'm only progressing as the athlete is able to perform the movements with the quality that we're looking for. So again, able to maintain that position for a 10 to 20-second isometric before we go into more dynamic. And then same thing with that A series, just starting with the least complex, which would probably be an A walk, progressing to the point where you're at an A triple switch with arms overhead as well. So those are probably the two of the biggest ones I would do. And then you have all of your, typical, or I should say, more foundational, fundamental core training as well.
Cool. So before you do like those core training or like the wall drill, the
Mm-hmm.
A series you mentioned, would you like do some myofascial release before that?
Only if I felt like they needed that. So if there were indications in the exam that there was a myofascial restriction, that's when I go to that release techniques. But I'm only really doing that if the exam indicates that that's necessary.
Nice, nice. So besides like posterior pelvic tilt, I know like hip obliquity is like another like big issue with probably all the athletes have like
Yeah,
this, like basketball athlete have it, like
right.
track athlete have it. Would you like would you do some manual therapy to like help them like get back to like neutral position, or try and work on that? Try to do like corrective exercise with like each individual athletes.
No, that's a great point that you bring up, and I'll even zoom out and say, just besides this specific example we're talking about, manual therapy, I think it's a great entry way to change the entry point for your session, so you can decrease pain threshold, or more importantly, for this example, and really I think athletes in general, is to increase the access to certain range of motion or joint positions. So that's what I'm always trying to do, and that's a great point. Yeah, like if we're going to work on the squat pattern, for example, well, let me make sure they have full access to that squat pattern first. That way, if we're loading it or trying to work on the quality of the movement, we have full access. So again, I think when the exam indicates that manual therapy is needed to improve that, then yes, I'll start the session with that as opposed to ending with it, because that way the quality of our session might be a little better, or the quality of their movement, or most importantly, the access they have to certain positions, postures, or range of motions. That's a great point.
Nice. So, the other thing I want to discuss is like return to play from like, let's say like knee injury, no matter it's like ACL, MCL, or like meniscus.
Mm-hmm.
Like, it's a big thing in football and basketball.
Yeah.
And it takes a long time for these athletes to return to field to be able to perform again. So, let's say when an athlete like tear the ACL, like MCL, or like these kind of like injury, what are your like return to play process? And
Yeah, that's it. Sorry, go ahead.
is it like a uh is it a timeline thing or is it a landmark thing?
Oh, that's a great question too. So I would say old school train of thought was yeah, timeline thing. And I think most of physical therapy reconditioning is moving towards more of a landmark base, like you mentioned. But I think tissue healing timelines are still certainly important to consider. Surgical constraints are important to consider. So, to answer your question, I think it's a combination of both. And that's usually going to be my answer on both things, where the question is it this or this? Usually it's a combination. So, yeah, I think in that process, it's a combination of both. And honestly, whether it's a knee or a shoulder surgery, whatever the operation was, the qualities that you're looking for, the system still remain the same. So for me, it tends to be okay in that beginning phase. We need to protect. Let's say we're talking about surgery. We need to protect the surgical site. We want to reduce pain, reduce inflammation, and increase range of motion. So that beginning phase, the acute, you're always focused on those things because if you don't have that foundation, if you never get those pain levels down or get that range of motion back, the later stages are going to become a lot harder. So at the beginning, you're always looking to restore those specific qualities that I mentioned, regardless of what the operation was. And then from there, once you've gotten hopefully your full range of motion back, working on the neuromuscular control through that range of motion, the functional movement patterns that introducing the squat, hinge, gait, push, pull, all of the fundamental movement patterns, and then just being stable throughout that range of motion as well. So you're still kind of in that acute moving towards intermediate, and now you're starting to get moving a little more. And then from there, hopefully introducing, I'm big on loading early and often. So there's always creative ways to introduce load. It can be through isometrics. That doesn't necessarily mean that, when we say loading, we don't mean get them under the barbell at day 6. It means introduce load however is comfortable. So whether that's just a seated single leg knee extension isometric at 60 degrees, that's still loading. So just introducing early loading and progressive strengthening from there. And then as you kind of restore some of those qualities of force production, you're also adding in certain tasks to enhance their force absorption ability. So now you're getting a little more into those decelerative qualities as you're building into more athletic demands. And then from there, you're going through, this is where honestly rehab and return to play is really just training modified. It's just strength and conditioning, because then you're starting to work towards, okay, isolated force, speed, change of direction tasks. Everything's pretty controlled, and we're trying to develop those qualities in a very controlled and predictable environment. And then as you work through that, you're building up that force production capacity, and then you build into more sport specific force, speed, power, and agility. And going through those progressions that I kind of mentioned earlier of, okay, change of direction becomes pre-planned, controlled, and agility becomes perceptual cognitive demands, chaotic, and a little more sport specific. And then eventually you're just progressing through graded reintroduction to sport itself, practice, game, etc.
Nice.
Hope that
So
was a really long-winded answer to your question.
no, I like it. I like it. So um uh around what timing or like what like landmark you check, then you start introducing like deceleration or like linear speed.
Oh, that's a great question. I think for deceleration, I want to make sure that, well, they should be jogging at that point. So that's one thing, is that they have the ability to even accelerate to bring in that deceleration demand if we're talking about on the field. When it comes to deceleration through plyometrics, though, I'm introducing that prior to running. So stuff like your snap downs, depth drops, broad jump with just a stick, and then kind of grouping in, this isn't deceleration, but introducing pre-running plyometrics as well, such as pogos, for example. Those are kind of my group of exercises that I want to introduce even prior to running, because running itself is just a plyometric. You're on one leg at a time. It's a single leg plyometric over and over again. So I don't think it's, outlandish to say that introducing plyos prior to running is a sensible progression. So that's one thing is introducing plyometrics in a more controlled decelerative manner prior to introducing deceleration on the field. And so then, yeah, whenever, I mean, linear speed wise, I'm introducing that once again, tissue healing timelines are important to consider. For example, knee surgery. Let's say 12 to 16 weeks is where you're aiming to run. Well, or aiming to start jogging. I'm going to let them have a little time with jogging until I then say, okay, well, now let's jog 10 yards at a little higher intensity and then come to a stop. So I think that one's a little hard to answer because a lot of it's going to depend on how their running, jogging goes in that 12 to 16 week mark, and then how their quality of movement looks with the deceleration based plyometrics. But I'm also using a lot of objective metrics through force plates, for example, to ensure that their deceleration, uh, performance is adequate objectively as well.
Cool. So, uh, as like return to play athlete, like football player, you mentioned that you're gonna use um first plate to like see where they are. So let's say like knee surgery, ACL,
Mm-hmm.
MCL, whatever it is. Um, is there like certain metrics you're gonna look into when it comes to return to play?
Yeah, great question. Yeah, so throughout the process, some of the big ones that I personally like to look at, again, depends on people's settings, but I've taken a liking to eccentric braking impulse, counter movement depth, and eccentric duration, and those tend to kind of go together and tell you a better story about the quality of the movement. And then concentric vertical impulse and jump height. Occasionally, there's a few others, but I'll leave it at those five for now.
Why eccentric like braking force and uh what's the time metric you mentioned for eccentric?
Eccentric braking impulse, and then the time one was eccentric duration.
Oh yeah, why eccentric duration and
Yeah.
eccentric braking impulse?
Okay, I'll give a good example for the eccentric duration. I think the easiest way to understand it is, let's say you're looking at a single leg vertical jump, and for both legs, they reach a depth of 34 centimeters in their counter movement depth. So great, looks awesome, right? We're equal, but on the non-surgical side, it took them half the amount of time it took the surgical side to reach that depth. So again, that's kind of how it tells the story of, all right, we got a similar depth, but it's taking the surgical side twice as long to reach that depth. So, if your eyes weren't on the person during the jump, now you've kind of seen the story through the numbers that they might be a little hesitant in loading or not have the ability to quite as quickly drop down into that max counter movement depth. So I think that's why it's kind of important to look at the eccentric duration in any kind of return to play. Is it does tell a story in confidence into loading that leg, I think. And then eccentric braking impulse, I think it's extremely important, one, to just look at the eccentric phase of a jump. I think it's super tempting to just look at metrics, more performance-based metrics such as jump height, concentric vertical impulse, etc., or RSM modified that wouldn't quite capture that phase of the jump. And then practically, I've just seen, in my personal experience, eccentric braking impulse reveal a lot of differences in, again, confidence in loading eccentrically on the surgical versus non-surgical side that you tend to miss if you don't look at that phase of the jump. I know some people also look at eccentric deceleration impulse, eccentric rate of force development. I think whatever is, you find useful in your setting.
Nice. Correct me if I'm wrong, but I I work with a uh he used to have like I think he had a ACL surgery like
Okay.
a year ago,
Mm-hmm.
and he did his rehab on like I don't know what facility that is, but
Mm-hmm.
after he came back, when I saw his running, like his change of direction, like I realized like his deceleration is kind of like he can't decelerate off of like using
Oh.
his surgery leg.
Mm-hmm.
And that was before I see the metrics on the force plate.
Mm-hmm.
I just realized maybe we should like do something. Maybe we should like introduce deceleration in like his
Yeah.
training. So is deceleration a thing that like let's say if athlete come back from surgery, it's easier for them to like produce the same amount like concentric power, but eccentric or like deceleration is harder for these athletes to get back from?
100%, I agree with you on that one. Maybe not every single athlete, but again, clinically speaking, from my experiences, that is exactly what I've seen commonly to be the case, and that's why I mentioned like I will not miss that on force plates is checking that phase of the jump. And so yeah, to your point, yes, I think that's very common is going into positions of deceleration, especially let's use the ACL as an example, that triple flexion position with maybe sometimes a positive shin angle tends to be a little harder to restore. So I think attacking it early is definitely really important, but with any injury that we're talking about, yeah, sometimes that force absorption capacity, because the forces are higher, usually with an eccentric contraction or even field-based eccentric movement, it's going to be a little harder for the athlete, as well as just cognitively or mentally their perception of how much harder it is to catch themselves than it is to just go out and accelerate. So all of that to say, that's why kind of in my return to play process, most of the time, that beginning phase, pre-field or even when we get to the field, I'm very much so hammering deceleration and kind of marrying that stimulus across the board, whether it's in the weight room, I do a lot of tempo or eccentric overloaded work. On the field, I'm just training the hell out of deceleration. And with those plyos that we mentioned earlier, same thing, just trying to build up that force absorption capacity, starting with body weight, non-altitude, building into altitude drops with weight added on.
Nice, nice. So, enough for like football questions. I want to ask about like baseball.
Yeah.
In baseball, there's a lot of like rotation. So
Mm-hmm.
there's gonna be one side like doing hip internal rotation, the other side is probably doing hip external rotation. Am I right?
Mm-hmm. Yeah.
And what if the athlete lack of like hip mobility on one side? What would you do?
Okay, so great question. That one, I will say, I'll preface by saying there are people that have worked in baseball a lot longer than me, so you should find them. But as far as my experiences go, my philosophy has always been that, let's just say asymmetry in general. The number one question is always to me, is it significant to that person in that situation? Because every case of asymmetry is going to be different. So, a commonly used example also is going to be whether you want to intervene or not. The common example there is baseball pitchers. The range of motion side to side in their shoulder is going to be different. So we know that to be the case. So not necessarily every asymmetry are you going to intervene, but the question is it significant? One, two, is it impacting this athlete? So I think that one's hard to answer. I'm going to give you a general answer on this one is answering those questions in the specific context of that athlete and that system is it significant? Is it impacting them situationally?
Well, so let's say if an athlete lack of like internal rotation
Mm-hmm.
on the left side
Mm-hmm.
and he probably like push off on the left side, so he's more of an external rotate. Am I right? Yeah.
Yeah, I think I'm following what you're saying.
Yeah,
Yeah.
yeah, yeah. So, does that like how is that gonna like impact the players?
Yeah, so I mean, in that case, again, it's going to be specific to the athlete, but if you found that the lack of hip internal rotation is significant and it's affecting them, then my number one question is going to be why is there a lack of hip internal rotation? So, important consideration is here is sometimes athletes, when you lay them on the table, they will have the range of motion. But for some reason, in that dynamic setting of their sport specific movement, they can't access it. So that's situation one is they have the range of motion, but they can't access it. Situation two normally is they don't have the range of motion. So then my question is why don't they have the range of motion as opposed to why do they have it but they can't access it? So if they don't have the range of motion, I'm using my exam, my objective assessments to figure out why they are lacking that range of motion, whether it's soft tissue, capsular, neuromuscular, etc., and then addressing it from there.
What if they have the range of motion but they can't use it?
So then it sounds like more of I'll say like coordination neuromuscular issue. So they have the range of motion, but for some reason they can't access it in a dynamic setting. So what we might have to do is regress that movement that we're trying to attack, unless you can make the adjustments necessary just with certain cueing. If you're able to cue them, whether it be with external cues or just tactile cues, whatever it is, and able to get that change that you're looking for and get the movement pattern restored, awesome. But if you can't, it might involve regressing the movement pattern until the athlete can access that range of motion in a less complex movement and building back up to the movement that you're looking for.
Cool. So you work with like tons of athlete and they need to like push off a lot. They want to have like great power output. Does that
Mm-hmm.
mean that they constantly live at a external rotation state?
I wouldn't say so because there's so many movement patterns that happen within the sport. So even if one happens repeatedly, which is common, for example, let's say the baseball pitcher, yeah, they're going into the same position repeatedly over and over again, but there still are other demands in the game that happen. But yeah, I think it's common for, I keep using the pitcher example, but because of that, it's common that, for example, they have increased external rotation on that side. So with a sport like baseball, no, it's not uncommon to find a movement pattern that's repeated over and over again per a certain position, like your catcher is in that deep squat position for a prolonged period of time. So yeah, not uncommon, but I still think that the sport has enough variability that other movement patterns happen as well.
Nice, nice, nice. So, um, I know I'm gonna jump out a question about training. I want to ask about
Yeah.
like your personal experience because you work with baseball, you work with football, and those are like all male dominant at
Yeah.
like sports. So I know there's like more and more like female in our field, like no matter like PT or like strength and conditioning coaches, but
Mm-hmm.
uh in your personal experience, do you find it hard to like to how do I say this?
Go for
Cooperate
it.
with
Say
this
it as bluntly as you want.
to cooperate with these athletes or like to find like I don't know. Is it easy for you to like just blend in?
Yeah, that's a great question. I think it's easy for me to blend in literally. No, I definitely stick out like a sore thumb most of the time. I know whenever anytime my friends were watching a game when I was in college football, they could find me pretty easily on the sidelines. But no, I mean, as far as blending in, you mentioned the athletes. I think that's quite honestly the easiest part. The athletes is where I find the least resistance, and I've always said this, but athletes don't care about your race, gender, ethnicity, religion. They don't care about anything besides are you good at your job and do you care about me? So that's what I always try to get across is I am good at my job, I'm confident in myself, and I care about you and I'm here to get you better. And that I think is what's always made me have such an easy time with the athletes. And truly they're the best part of it. They're the best part of it. So I've never had no, I've never had any issues with athletes in that sense. They're easy to work with and they're fun to work with, and football players are just big teddy bears in my opinion.
How about working with colleagues?
Working with colleagues, I mean, same thing. I've been fortunate enough where I haven't had. Yes, do I think there's certain at a systemic level certain differences being a female working in sport, especially male dominated sport? Absolutely. On like a micro level day to day, I've been lucky enough to not have, too many issues, but I'd be lying to you if I said there weren't points of adversity that were probably linked to the fact that I'm a female. Yes. But everyone has challenges in the workplace for differing reasons, and my biggest thing is educating people on why it just matters that we are good at our job and it doesn't matter what we look like or which locker room we use.
Cool. So, what exactly at the first place brought like got you into like physical therapist?
Oh, that's a good question. I always knew I wanted to be in healthcare, and I'm very interested in helping people. I was big on philanthropy in college, so wanted to do something to help people. And then everybody jokes physical therapists are all just failed athletes, and that's pretty much what I am. I wasn't good enough to play in college or keep going, so you want to stay around sports, you got to figure out a way to work in sports. And PT just called to me because I never saw myself working at a desk job. I wanted to be a little more active than that. Originally I thought I wanted to be like a sports med doc. And then I, in undergrad, realized I was not ready for physics too. So I changed my major to kinesiology and went with physical therapy instead.
Nice, nice. So, uh, working with like you kind of have like PT and strength and conditioning coaches. You're
Hmm.
at the same time, you're both um compared to like coaches who have like only like he's only like strength and conditioning coaches or PT who only work with clinic. They never see how player moves.
Hmm.
Mm, how does that help you? And do you find like hard to communicate with probably coaches who only are strength and conditioning coaches who don't have like PT background?
No, honestly, not at all. No, I think if anything, kind of what I mentioned earlier, having both has expanded who I can communicate with and how I can communicate with them. So when I was quote unquote just a PT, I probably found it a little more difficult to communicate with strength coaches because I didn't understand their language. But now on the flip side, where I understand both, I think it's become a lot easier for me to communicate with both sides of the spectrum, as well as like on a deeper level, understand what people are looking for. Because sometimes working in sport, ego gets involved, and this person wants to be in charge of the sprint progression. This person wants to be in charge of the weight room programming. So when you have an understanding of what each profession brings to the table, their strengths, their areas of expertise. And I think that just makes it a lot easier to disarm egos and get everybody a seat at the table and kind of get along and do what's best for the athlete.
Nice. So working with different sports, like which sport you enjoy the most?
So far I've only worked with, like we said, baseball and football. I'm definitely a football girl. I will say that something about kind of the environment and the intensity, and probably the schedule is a lot more fun to me in football. But baseball, like I said, taught me a lot that I took to football. And then the other sport I would mention is, I mean, prior to my introduction to football, I was big on women's soccer. My dream was to be the physical therapist for the United States women's national team. So I've always had a love for women's soccer as well. I think they're up there with some of the toughest athletes that we have.
Cool. And the game demand are like compared to baseball, soccer more like football, right?
Yeah, yeah. I think it's a lot more. There's a lot more high intensity, high speed demands. Kind of like you said, similar to football. I think baseball is much more played much more in an acceleration based manner due to just literally the dimensions of the field, the distance you have which to accelerate. Whereas soccer, you have a much bigger area to work with, similar to football. But yeah, I think one big thing is that the game demands only seem to be going up in the soccer world as well. So that's also something to consider.
Nice, nice, nice. So, that's basically all the question I have for you today.
Awesome.
So, for those who are interested in what we're talking about today, where can they reach out to you?
They can reach out to me on Instagram or Twitter, or I'm big on LinkedIn. On Instagram, if you search Azita, I'll probably be one of the only people to pop up. But I actually don't even know my Instagram handle. But just search Azita DPT Strength, and it should pop up. And then same thing on Twitter.
Nice.